tendon and radial artery. So when you place your finger here, you can feel the pulsation of radial artery, and points is in between. So usually for wrist points on the anterior side of the forearm, usually it would be better to put pillow underneath so that the wrist is slightly flexed, and you can feel the depression between the tendon and artery. So it should be about here. Okay, so that's lung 9. And next one is pericardium 7. So it's at the wrist joint between tendon of palmaris longus and flexor carpi radialis. So can you do opposition of finger? So that is a palmaris longus, and the one on the radial side is a tendon of flexor carpi radialis. So in between we have pericardium 7. You can relax. And then heart 7, it's at the wrist joint. It's on the radial side of the flexor carpi ulnaris. The flexor carpi ulnaris is attached to the pisiform at the corner of the palm. So you can feel the tight tissue here. That's the tendon of flexor carpi ulnaris. So if you go radial side, you're moving towards the thumb side, and that should be heart 7. Okay.
It's on the radial side of the tendon?
So it's radial side of the tendon and proximal to pisiform, right? So that's heart 7. So next one. Oh, before we go over, so lung 9 is close to radial artery. Pericardium 7 close to median nerve. And this one we have ulnar nerve and artery, right? So you have to be careful with the needling. And next one is large intestine 5. It's on the radial side of the wrist. It's on the center of hollow formed by tendon of extensor pollicis brevis. So tilt up your thumb. So between extensor pollicis brevis, extensor pollicis longus, you can feel depression there. So when the person relaxes their thumb, you can actually feel the wrist joint, and that should be large intestine 5. In some people, the radial artery actually deviates towards large intestine 5. So sometimes you may feel some pulsation of radial artery. Then you also have to be careful with the needling. And next one, we'll go over Sanjiao 4 first. So it's on the dorsum of the wrist, level with the wrist joint, and depression between tendon of extensor digitorum communis. So when you and slightly extend, yeah, so this is the tendon of extensor digitorum communis, and the one goes to the little finger is digiti minimi. So in between, at the wrist joint, that should be Sanjiao 4. And if you go in between large intestine 5 and Sanjiao 4, if you go about halfway, that's in the depression on the radial side of the tendon of extensor digitorum communis. So that should be Zhongchuan. Extra point. Zhongchuan. Yeah. Okay, and then the last 2 points is on the ulna side. So it's on the ulna border of the hand. Depression between the base of the 5th metacarpal bone. The base of 5th metacarpal bone is here, and triquetral bone is here. So in between, you can actually feel depression there. That is small intestine 4. And small intestine 5 on the ulnar border of the wrist. Depression between head of the ulna. Head of the ulna is here, and between head of ulna and triquetral bone. So point is right here. So usually, if you put your 2 finger at the ulnar side of the wrist, you can feel 2 depression. The one distal one is 4, proximal one is 5. Okay. So that's the wrist point. Since these are easy ones, we'll go over points on the anterior side of the arm as well. The first one is long 5. Long 5 is on the flexor aspect of the forearm, which is the anterior aspect of the forearm. It's on the line between long 9 and long 5. So long 5 was on the cubital crease. Which side of the tendon?
Radial side.
On the radial side of the bicep tendon. So when you locate long 5 and long 9, you're going to draw the line, and the point is located in between these 2 points. So it's 7 chin proximal to long 9. So from wrist crease to cubital crease, how many chin? 12 chin. So if you go halfway, we'll just mark halfway here. So that's halfway point. So if you move 1 chin proximal to that, that should be long 6. But if you're not sure, you could always measure halfway, another half, and then you could do probably third, right? So that's long 7, or long 6. And long 7, the name of the point is broken sequence, so it's not exactly on the line between 9 and 5. It's on the radial aspect of the forearm. It's about 1.5 chin up, and between tendons of brachioradialis and abductor pollicis longus. So what you do is from the radial side of the wrist, you're gonna move up. You're gonna palpate the base of the radius, and you'll move up, and you will feel the first depression forms proximal to the radius, and you're gonna have to feel the depression formed by this and this tendon, 2 tendons. So it should be about here. Although it's broken sequence, so it's a bit off from the regular long meridian point, because this is still in meridian point, the point should be still more on the in portion of the body, not the yang portion. Okay. And long 8 is on the anterior side of the forearm. It's 1 chin proximal to long 9. So if you move up, and again you're palpating the base of the radius, and when you move up, the first depression you feel off of the proximal end of the base is usually about 1 chin. So if you're not sure, measure halfway, find 6 chin, another halfway to find 3 chin, and then you do another half to find 1.5 chin. Okay.
So lung is not exactly on the line of the.
This one is just it's not. You could say technically, but it's just the 1 chin up. Yeah, I think. This one should be. Yeah. And next one. So since long 8 is also close to radial artery, this is also cautionary point for radial artery. Next one is pericardium 4. So it's on the flexor aspect of the forearm. It's 5 chin proximal to PC7. So what you do is measure halfway, and then let's put another halfway. So if you do another halfway, that's 3 chin. This was 6 chin, so you divide that into third to locate 5 chin proximal to PC7. So that's PC4. PC5 is on the flexor aspect of the forearm. It's 3 chin proximal to PC7. So you're gonna do halfway and another halfway, right? So that's PC5.
Say again, PC4 is how many proximal to PC7?
What?
How many chin is PC4 proximal to PC7?
5 chin.
Okay.
And this one is 3 chin. And PC6 is 2 chin proximal to PC7. So this is 3 chin. So if you divide that into third, that's 2 chin. So B here. So that's PC6. PC6 also common point that it can stimulate median nerve, so you have to be a bit more careful with the needling. And next is the heart point. So heart point is easy. So this is heart 7. Heart 4 is on the radial aspect of the radial side of the tendon of flexor carpi ulnaris. It's 1.5 chin proximal to heart 7. Lung 7 was about 1.5 chin proximal to wrist joint, right? So if you move about 1.5, should be about here. That's heart 4. And then heart 5 is 1. Heart 4 is 1 chin proximal. Heart 5 is 1 chin proximal. And heart 6, 0.5 chin proximal. And then heart 7, it's at the wrist crease. Right? So those are the heart points, and all these points cause 3.4 ulnar artery and nerve. And then we have extra point. Halfway point is Bijon, or middle point. So you just go halfway. And Irby point is too wide, so it's 2 points. It's 4 chin proximal to the wrist crease. 1 point in between palmaris longus and flexor carpi radialis. The other one is on the radial side of the flexor carpi radialis. So that should be Irby. Oh, no. Oh, hold on, 2, 3, 4. Oh, this one here. 4, 5, 6. Yeah. Oh, no. Sorry.
Yeah.
Okay, yeah, that was the halfway point. So Irby should be 4 chin up, and both sides of the flexor carpi radialis.
So where's the? I thought flexor carpi radialis is the one that.
Radialis is this one. This is the palmaris longus.
Oh.
Yeah. So once you locate points, you can kind of compare the location of points from one meridian to another. So when you look, this is a wrist joint, 0.5, 1 chin, 1.5, that's 2 chin, 3, 4, 5, 6, and this is 7 chin. So see if the distance proportion-wise it's about the same. Okay.
Another question is this is a line between PC and
It's PC point. Usually we just find the depression between 2 tendons.
Oh.
Yeah.
Can we put a P3 here as a marker to measure the twins there instead?
Yeah, that's fine. It's same. Yeah, you just find the medial side. So that's it. So locate these points, and when you're done, I'll check the location for you.
Thank you.
This one is large intestine 6. So large intestine points are on the line between LI5, which is at the radial side of the wrist, at the wrist joint between 2 tendons. So that is LI5. The other point is LI11. So LI11, 2 ways to locate points. One, when you fully flexed the person's arm, it's at the lateral end of the cubital crease. Or you could find the lateral epicondyle of humerus and find lung 5 and go halfway. Okay, so that's LI11. So points between 5 and 11 are on the line between these 2 points. Okay, so first is LI6. Li6 is reaching proximal to Li5 on the line connecting 5 to 11. So what you do is from wrist joint to cubital crease, that's 12 chin. So if you go halfway, that is 6 chin. If you do another half, that is 3 chin, right? So if you move about halfway, that will be Li6. So in this position, the point is you have bone right underneath, so you will have to insert the needle more like 30-degree angle. And next one is Li7. So that's 5 chin proximal to Li5 on the line connecting 5 and 11. So if you divide it into half, that's 6 chin. This is 3 chin distance. 3 chin distance. Then between 3 and halfway 6 chin distance, you divide it into equal third. So if you move up along the channel, you could probably find another depression.
Is there always a depression?
Usually, yes.
And is it depression in the bone or muscle, or just like the tissue itself?
Usually it could be between tendons or between muscles, or yeah, or between
But
like
it-
bones.
Is it always an anatomical, or is it a sensation of a depression where the channel would be?
No, you will actually feel the physical depression.
Okay.
Yeah. So that is Li7. And if you divide it into half, that's 6 chin. So between halfway to Li11, if you do another halfway, that is 3 chin distal to large intestine 11, which is large intestine 9. So it's on the radial side of the forearm, 3 chin distal to Li11, and the line between Li5 and 11. Okay. And Li10 is 2 chin distal. So if this is 3 chin, you have to divide this into equal third to locate 2 chin distal to the point. So that should be large intestine 10. And large intestine 8 is 4 chin distal to Li11. So from here, if you move 4 chin distal, that should be Li8. So that's all. Yeah. Okay.
That's easy.
Okay, so you guys can locate these points.
Question.
Fusion proximal to Sanjiao 4, which is located at the wrist joint. It's in the depression between radius and ulna, and it's on the radial side of extensor digitorum communis. So what you do is, you could do in 2 ways. First, measure the distance from wrist crease to cubital crease, divide into half, and then you could take another half. We'll just mark this one. So that's 3 chin proximal to wrist crease, and from Sanjiao 4, which is at the wrist crease, to here, if you divide into third, 2 chin up should be about here. Okay. Usually, Sanjiao 5, when you palpate radius and ulna, if you start from the wrist joint and move up, you're palpating radius and ulna. If you go first depression proximal to the junction of radius and ulna, that is usually Sanjiao 5. Okay.
That's 2 chin proximal to
2 chin
Sanjiao 4?
proximal to 4.
Okay.
Yeah. So if you want to put it on the, usually in Chinese textbook, they don't really specify which side of the tendon, but if you want to put it on the radial side, you could just ask the patient to move their finger, and then you can feel the contraction of extensor digitorum communis, and then you just put it on the radial side. Okay. The next one is Sanjiao 6. This one is 3 chin proximal to Sanjiao 4, so level with this point. It's depression between radius and ulna. It's on the radial side of extensor digitorum communis. So what you do is feel for the muscle. If you're not sure, again, you could extend your finger and wrist, and then you can find the depression on the radial side of the muscle. Usually, Sanjiao 6, you could just put the point closer to the radius and right on the side of the radius. Okay, that should be Sanjiao 6. Sanjiao 7 is same level with Sanjiao 6. So you move 3 chin proximal to Sanjiao 4, but now you're putting closer to the ulna. So it's depression between ulna and extensor digitorum communis, which is right here, right? So when you, again, extend, and you could put on the other side and find the depression in between, then that should be Sanjiao 7. And Sanjiao 8 is 4 chin proximal to Sanjiao 4. So what you do is from wrist crease to cubital crease, divide it into half. And then this is another half. So you're going to divide it into third to locate 4 chin. So this one also on the radial side of extensor digitorum communis. So you could move 1 chin up, and it should be about here. So that's Sanjiao 8. Sanjiao 9, there are 2 ways of locating points depending on patient's arm position. Usually in this position, what you do is you draw the line from Sanjiao 4 in lateral epicondyle of the humerus, and Sanjiao 5 will be located in between these 2 landmarks. Okay? But in case patient is lying down on their stomach, and in case their arm is in this position, you have to draw the line from Sanjiao 4 to tip of the olecranon. So depending on textbook, they may use different landmarks, but it's because depending on patient's arm position, you will have to take different landmarks. The important thing is Sanjiao 9 is located between radius and ulna. Okay, so in this position, you will find halfway, which is 6 chin, and then you'll have to move 1 chin up, right? So half and 1 chin up. That should be Sanjiao 9. And then we'll do 2 more points. Small intestine 6 is on top of this top of the it's head of the ulna, and what you do is when you place your finger on top of this head of the ulna, the highest point.
Styloid process? Yeah.
Styloid process is actually
actually there.
There. So I think the admin actually used the wrong description. But place your finger on top of the head of the ulna, and then when the person turns their palm towards the chest, the ulna will rotate, and then you will actually feel depression there. So that should be small intestine 9. So usually at this point, the arm has to be more in the stomach or chest area so that you can actually get some depression for the point. Okay. So when this arm,
when you insert the needle, the arm has to be on the chest,
usually
right?
that's the only way you can get
Yeah,
the
because
depression.
you got the
Yeah.
depression. Okay.
And we'll do one more point, which is small intestine 7. Small intestine 7 is located between small intestine 5 and small intestine 8, which is between the tip of the olecranon and medial epicondyle of humerus. If you go halfway, that is small intestine 8. And small intestine 7, it's 5 chin proximal to small intestine 5, and it's depression between the ulna and muscle belly of flexor carpi ulnaris. Flexor carpi ulnaris is located here. So what you do is you will measure the chin from wrist crease to cubital crease. That's 12 chin. Go halfway. That is 6 chin. Okay, if that's 6 chin, then you move 1 chin distal to it, and you're gonna go depression between the ulna and the muscle, so it should be about here. Okay, that's small intestine 7. Okay, that's all. So you can locate these 8 points, and then between midpoint of the shaft of the first metacarpal bone and femoral muscle. So if you locate first metacarpal bone. The head is located here, right at the joint, and the base is here. For this point, you have to make sure you're not counting the wrist bones when you divide the first metacarpal bone in half. Okay, so find the base, find the head, and go halfway. And when you go halfway, it's depression between the first metacarpal bone and then tendon eminence muscle. Okay,
There's a lung, or what is that?
lung 10. And pericardium 8 is between second and third metacarpal bone. It's proximal to metacarpal phalangeal joint. Metacarpal phalangeal joint, or these one, joint formed by metacarpal bone and phalanges, right? So when you place your finger between second and third metacarpal phalangeal joint, you're gonna move proximally and feel for the first depression, and that should be pericardium 8. Okay.
Is it
So,
okay
can I
if
ask-
we,
You go.
yeah, make the fist?
So when you
in
make
front?
a tight, when you make a fist, you have to make a tight fist, not the big fist, because if you do that, it may end up too high.
And
So-
when you mean depression, is it like where the two phalangeals meet at the next joint space, or is it just the first kind of depression you feel in the tissue?
The first depression you feel when you move proximal to first and second metacarpal phalangeal joint. Okay. Okay, so that is PC8. Part 8, the way you locate point is same. You find fourth and fifth metacarpal bone. This is the metacarpal phalangeal joint. So you're gonna move your finger proximal to metacarpal phalangeal joint of fourth and fifth, and then feel the first depression. So that should be part 8. Okay. And on the dorsum of the hand, we have large intestine 4. So it's on the dorsum of the hand between first and second metacarpal bones. It's midpoint of the second metacarpal bone. So if you find the junction between first and second metacarpal bone, that's where the base of the metacarpal bone located. The half of the knuckle is the head of the second metacarpal bone, right? So if you go about halfway, it's between first and second metacarpal bone, but it's closer to the second metacarpal bone. So the point should be about here.
The large intestine 4.
Large intestine 4. And then Yao Tong Sui for lumbar pain. So what you do is on the dorsum of the hand, you find 2 points. One is between second and third metacarpal bone, the other one between fourth and fifth. So what you do is when you feel the junction of the base of the second and third metacarpal bone, what you do is you have to move distally and feel for the depression, and that should be Tong Sui point. So that's 1 point, the other one is here. So that's distal to the junction of base of fourth and fifth and second and third. In general, these points is about halfway between the metacarpal phalangeal joint, knuckle, and wrist crease. Okay, that's about halfway.
What are those points called?
Yao Tong Sui. Okay. Do you want to find these points first? Okay. Just distal to the metacarpal phalangeal joint. So what you do is place your finger in the center of the metacarpal phalangeal joint. You're gonna move your finger distally and feel for the first depression of the metacarpal phalangeal joint. Okay, so that's large intestine 2. Large intestine 3 is also on the radial side of the index finger. It's substantial depression proximal to the head of second metacarpal bone, which is the same head of the metacarpal bone forms the metacarpal phalangeal joint. So the way you locate point is the same. Place your finger on top of the MCP joint. You're gonna move your finger proximally and feel for the first substantial depression. Okay, So that will be large intestine 3. Okay. And the next one is extra point. It's on the dorsum of the hand. It says here. It's depression proximal to second and third metacarpophalangeal joint. So if you place your finger between second and third metacarpophalangeal joint, you're going to move your finger proximally and feel for the first depression, that is the Lawson. So the way you locate this point is same as the Laogong, which is a pericardium 8. So the other name for Lawson is Y Laogong. Okay, so it's outside the Laogong point. So Lawson and Y Laogong is same point, it's just named differently because it's the extra point. Sanjiao 3 is on the dorsum of the hand. It's depression proximal to 4th and 5th metacarpophalangeal joint. So when you place your finger here, you're going to move your finger proximally and feel for the first depression, that is Sanjiao 3. Okay. Small intestine 2 is located on the ulnar border of the little finger. It's distal to metacarpophalangeal joint. So place your finger on metacarpophalangeal joint. You're going to move your finger distally, and first depression you feel off of the MCP joint is small intestine 2. If you move your finger proximally from 5th MCP joint, and when you feel depression, that is small intestine 3. So small intestine 3, often we say it's where the palm line ends. Okay? We'll do 2 more, which is Sanjiao 2, which is between fingers. So it's between ring finger and little finger. It's 0.5 to proximal to the margin of the web, so it's usually about here. Baxie is 8 pathogen points, so we have 4 points each hand. So 1 between thumb and index finger, the other one between second and third, and then we have the one between third and fourth. Okay, so you guys can locate these points.
No, okay, 4th and 5th.